And I'm here this evening with my colleague and friend, Congresswoman Lauren Underwood. Congresswoman Underwood represents Illinois' 14th district, which is the western and northwestern suburbs of Chicago, if I'm correct. Welcome, Lauren.
Thank you.
Congresswoman Underwood and I were both elected in 2018, and she has been my go-to for public health information over the last several years. Congresswoman Underwood is a registered nurse, a healthcare policy professional. She served in the U.S. Department of Health and Human Services as a senior advisor for President Barack Obama. So her professional experience as a nurse and a public health policy expert allowed her to really hit the ground running in our freshman term. So a few weeks into our first session, Congresswoman Underwood and Congresswoman Alma Adams Maternal Health Caucus, and I'm honored to be a member of this bipartisan caucus, which has grown to more than 100 members. So congratulations, Congresswoman. You know, I first became aware of the issue of maternal mortality when I was running for Congress. I'd spent my career working in the legal services field. But when you run for Congress, all of a sudden people start asking you questions about reproductive health. So as I started to, really dig into the issue, I was shocked and appalled at what I learned about the statistics on maternal mortality rates in our country. So even as maternal mortality rates are decreasing in most of the world, the US is the only developed country in the world with a rising maternal mortality rate. And within the US, Black women are 3 to 4 times more likely to die from pregnancy-related complications. The causes are complex. They include systemic racism. In fact, that's probably a driving force. And even a Black woman with a college degree is more likely to die from giving birth than a white woman without a high school diploma. And while we mentioned that the rates for Black women are 3 to 4 times worse than for the general population, the US rates are 3 to 4 times worse than the rest of the world. So we're in a really bad situation here, and this is something that has really been crying out for action. Philadelphia, part of which I represent, has some of the country's best academic medical centers, but the city's pregnancy-related death rate is above the national average, and Black women make up almost 3/4 of those deaths. So a very timely conversation, very relevant to our region. The month of April is recognized in the United States as National Minority Health Month, and this week, April 11th through 17th, is the 4th annual Black Maternal Health Week, founded and led by the Black Mamas Matter Alliance. So I'm so thankful to have this conversation today. Congresswoman Underwood, with the Black Maternal Health Caucus, has really put a spotlight on this issue. And one of the last official things we did in DC last March, before things really shut down with the pandemic, just pre-pandemic, the Maternal Health Caucus, led by Representative Underwood, introduced 12 bills called the Black Maternal Health Momnibus. Usually when there's a package of bills in DC, it's called an omnibus, but this, of course, is a momnibus. We're so honored to be part of that group, and the introduction and the press conference that introduced it included your Senate co-sponsor, then Senator Kamala Harris, who of course now is the Vice President. So it's really great to have both the attention and the level of attention which this issue has been getting. So before we dive into questions specifically about the acts, I was just going to go over sort of the top line for each of the 12 bills now that are included in this package. It's been reintroduced in the new Congress with some additions. So the things that this package would try to do would be, number one, to make critical investments in areas that influence maternal health outcomes like housing, transportation, and nutrition. Provide funding to community-based organizations that are working to improve maternal health outcomes. Comprehensively study the unique health risks facing pregnant and postpartum veterans and support VA maternity care. Grow and diversify the prenatal workforce to ensure that every mom in America receives culturally competent maternity care and support. Improve data collection and quality measures to understand how we got here. Support moms with maternal mental health conditions. And I think we probably all know someone who suffered from postpartum depression or other issues relating to pregnancy. Improve maternal health care and support for incarcerated moms. Invest in digital tools like telehealth to improve maternal health outcomes. Promote innovative payment models to incentivize high quality maternal care. Invest in federal programs to address the unique risks for and effects of COVID-19 during and after pregnancy and other public health emergencies. Invest in community-based initiatives to reduce levels of exposure to climate change risks for moms and babies, and promote maternal vaccinations. So there's a lot here, and Lauren has been involved in the development of all of this, so I'm really excited to dig in. Seems like maybe we should start with a topic that has infiltrated literally every aspect of our lives this year, and this is the pandemic. So how has COVID-19 impacted the Black maternal health crisis, and how can the Momnibus help address some of it?
Well, Mary Gay, first of all, thank you for having me. Thank you for being such an engaged member of the Black Maternal Health Caucus from the very beginning. Thanks for believing in what we were seeking to accomplish with the Momnibus, and really just taking ownership, recognizing how important it is for all of our communities, including Philadelphia and the rest of Pennsylvania. You know, I think that there is such an important story to tell locally in every community about the impact of our nation's maternal mortality crisis. And Philadelphia is not immune. My team gave me this wonderful article from your health director that describes, you know, some of the findings in terms of the impact of maternal death and you know, severe morbidity, meaning, you know, near misses, right? People who had extremely difficult circumstances. And it's something that I can tell is just such an incredibly important priority for your community. And I'm really honored to be able to start Black Maternal Health Week by having this conversation. So you asked about COVID, and I think that that is the central question, because we've seen how the COVID-19 pandemic has really just put a bright spotlight on longstanding inequities in this country, right? And maternal outcomes have not been immune. The Journal for the American Medical Association and the CDC, their Morbidity and Mortality Weekly Report, have both been sharing information about the impact of the pandemic on maternal health outcomes. And what we know is that for people who birthing people who are diagnosed with COVID, they're more likely to have severe illness. That's number one. We know that Black birthing people and Hispanic birthing people are more likely to be diagnosed with COVID. So you have this group subset of people more likely to be frontline essential workers, for example, who are more likely to get the disease, more likely to have severe illness when they get the disease, and more likely, right, when you get COVID and you're pregnant, you're more likely to have a negative maternal health outcome. And so, meaning death is a higher possibility. So we knew that we needed to include some COVID-19 related items into our larger Momnibus package. And you have to remember, I'm sure you saw in the news, Mary Gay, or even from your personal experiences, what happened last spring when the best advice from all the medical experts were to stay out of the hospital. And so many birthing people heard that and then found themselves isolated when they were going in to deliver their babies, right? And so for a lot of folks who knew the statistics coming in, now they've lost their partner, their spouse, their doula, their anchor during a time when they sometimes really need to have that kind of advocate in that delivery room with them. Now they're there alone. And so this kind of support, not only our Maternal Health Pandemic Response Act, which is the legislation in the Momnibus that I introduced with Senator Elizabeth Warren to specifically address the COVID-19 related issues, meaning underrepresentation, i.e. there were no pregnant people included in these clinical trials for the vaccine and these treatments. So there's not been recommendations, which has been awful, but then also recognizing some of the trauma and challenges happening like in our healthcare system, right? Like in these delivery rooms when people don't have that kind of support, and making sure that when we talk about diversifying the perinatal workforce and every birthing person being able to choose a provider, it's in circumstances like this, right? So that if you don't have that advocate in the room, you have that trust, you have that ability to communicate and have empathy and understanding between you and that provider, so that everyone can have a healthy, positive experience.
Well, and as you're talking about people feeling isolated, I mean, I remember being, pregnant for the first time, and you just really rely on other people to, help you understand what's going on and how you're going to get through this crazy experience. So, not having those supports would be really, really tough. When we talk about maternal health, we are talking about pregnancy, but we're also talking postpartum as well,
That's right.
right? And how does the act address some of those issues?
So, when we talk about this issue, I think it's important to remember there's the preconception period, where, when we talk about choice, right, often reproductive choice is really centered in that time, what's going on in that period. There's the prenatal period, right, where people may be getting care, but they may not. There's labor and delivery, and there's postpartum. We talk about maternal mortality, right, dying of a pregnancy related complication. That usually centers on the labor, delivery, and postpartum periods. But right now, present day, most of the deaths are occurring in the postpartum period, and not that immediate postpartum period where that birthing person may still be hospitalized, right? So you're in the hospital, 24 to 48 hours after delivery? Not necessarily are most of the deaths occurring in that period. Most are actually occurring in the extended period up to a year long postpartum. And so people have been dying of things, infection. We've seen a real rise in the impact of substance use and suicide
Mhm.
in this population. And, all there's obviously hemorrhage and cardiovascular related issues. But there's many, many, many different reasons that folks may be dying in that postpartum period. And all of our work in the Momnibus is focused on one, making sure that people actually have care throughout that full postpartum period, which we actually addressed in the American Rescue Plan related to Medicaid, but then also that they're getting all the other services they may need. It's not just about having insurance, right? It's about everything else. And the Momnibus addresses that for the full postpartum period.
Well, and that was one of the things that really struck me when I started to dig into the issue is that this is something we can fix. Other developed countries have fixed this. They generally have much more extended and better postpartum care,
Yes.
um, and thereby short-circuiting all these issues. I mean, what is sort of the difference that we see from other countries, from Canada or Europe?
Yep. So I'm 34. This has been a disparity that's been around my entire lifetime. And it's something that we've never seen prior to, I'd say, the last 2 to 3 years, of widespread federal initiatives to try to change. And so this is a problem that's been, a challenge in our country for a very long time. And it's been, I wouldn't say accepted, but, people hadn't been doing this work in the policy circles with a sense of urgency. But what we know from other countries is that, and we know from our work domestically, that there are evidence-based, data-driven solutions. And that is exactly what's in the Momnibus. When we talk about social determinants of health, like nutrition and transportation and housing, well, there's a rich evidence base to suggest that if you can end hunger, right? And then that really helps improve the health status of not only anybody in the community, but especially a postpartum or lactating person. And so as a result, in our bill, we expand and extend WIC coverage for breastfeeding people, for example, for 24 months, so they're not going hungry while trying to breastfeed. Critically important. I think that, this is a problem that has a solution. So often we are asked to solve big problems in Congress and we're seeking answers. Well, this is one where the answers are right here. We just have to have the courage and the commitment to solve it.
Well, the courage, the commitment, and I can't help but think that having more women in Congress might have refocused some of the attention.
Yes,
So
agreed.
I'm so glad to serve with you on this issue. Uh,
Same.
you know, one of the issues that's addressed in a particular bill has to do with women in prisons.
Yes.
As we seen more incarceration. We have to deal with women in prison. So what are some of the unique issues there?
So our Justice for Incarcerated Moms Act is led by Congresswoman Ayanna Pressley. And here's what's so interesting. In our federal prisons, we still have moms being shackled
Hmm.
during delivery. They are being asked to bring their babies into the world in conditions that would never be acceptable in our civilian either birth centers or labor and delivery units in the hospital, and we can do better. This is a clinical care issue. This is an equity issue, and it's something we have to remember that pregnancy is not a disease.
Interesting way to think about it.
It's not. And this is something where we do have clinical interventions, but it's not a disease. And so let's make sure that the setting is not, creating additional harms and traumas. Um, and that's, in my
Particularly
opinion,
to a child who
that's right.
what you do at that point could have impact their entire life.
That's right. And so there's really rich evidence and a lot of support, bipartisan support around the country. So individual states, because our criminal justice system, I mean, you serve on judiciary, right? You are very intimately familiar with our criminal justice system, has there at the state level, many states led by their Republican-led legislatures have banned shackling during delivery in their state-run prisons. And yet this hasn't happened at the federal level, for example. And so when we talk about doing this work, when we talk about the bipartisan nature of this work, even thorny issues like criminal justice reform as it intersects with maternal mortality may be viewed in a partisan lens, but the solutions have broad appeal across the ideologic spectrum, especially when you look at what's happening in individual communities.
That's amazing. That's good to know. Um, so you've worked in public health for a long time. What brought you to this issue?
Yeah, so like so many people, I know someone who died. One of my classmates from graduate school, who was a good friend, was expecting a baby in January of 2017. She gave birth to a beautiful baby girl named Soleil. Her name was Dr. Shalon Irving. And 3 weeks after she delivered her baby, she died. And it came as a real shock to me. Shalon had a dual PhD in gerontology and sociology. She was a lieutenant commander in the United States Public Health Service Commission Corps, working at CDC to try to end health disparities, and had done everything right. Highly educated, got all the prenatal care. She was excited to be a mom, taking great care of herself. And we still lost her. And so, while I was grieving her death, I also just happened to be deciding to run for Congress. And I knew that if I won my election, that this is something that I would want to tackle. Now, I didn't know that we would have an opportunity to start this caucus, that I'd be able to work with great champions and advocates like you and like Congresswoman Adams and Senator Booker and Vice President Harris and, our whole now group. I didn't know that there's that amount of support. I think what's really important for folks to remember, and this is my experience, you tell me what you think, Mary Kay. I think people assume that Congress works on the most important issues facing our country.
No.
Congress works on the issues that members raise. That's been my experience. And so as soon as we can bring something like this to the table, as soon as we can create a caucus that can be a hub of activity for people to bring us ideas, then we can offer these solutions that have broad appeal. And that's sort of, I think, that's my genesis story, origin story. And I'm excited about the progress that we've made together.
Well, and I think anyone watching this can see why this caucus has been so successful and why you have the Momnibus, already teed up and ready to move forward with such broad support. It's very inspiring. So a large part of the bill has to do with making sure that pregnant people can have a choice in their maternal health care.
Yes.
How does that happen?
So I represent a community that's rural and suburban. And I have a county, I represent 7 counties. One of my counties doesn't have a hospital. So when you have a hospital, you just have fewer health providers in that community, which means even, an hour or so outside of Chicago, there's some folks that don't have a choice in providers. There may just be one, maybe just one OB in town, and that's who you have to use. If there's not that cultural congruency or linguistic congruency, right, that can have some significant impacts on the quality of care and the birth outcomes. And I'm not saying that that provider is inadequate. I'm saying that the birthing, I believe, and I think that we have affirmed in our caucus that people should have a choice in who they see in terms of providers. And that should not be limited by urban or rural, like where you live. It shouldn't be limited by what language you speak or your race and ethnicity or your religion, right? That we need to have culturally competent care in this country, and the data, the biomedical evidence has been so clear that when there is that kind of congruency, the maternal and infant health outcomes are improved. So what we did in the bill with our Perinatal Workforce Act is that we have made key investments to not only grow the workforce of obstetricians and physician assistants and midwives and nurse midwives and doulas and lactation consultants, but also to diversify that workforce. Here's why that's important. In your community, right, you represent a partially urban area.
Yes.
With, you know, incredible healthcare systems. You have CHOP, you have Penn and the School of Nursing, and like this really rich source of great clinical care. So you probably have midwives and nurse midwives and doulas and lactation consultants in your community. I can tell you, some places in mine, they just don't exist. You can't find them, regardless about language or background or anything like that. They just aren't around. We need more of these providers, not fewer.
Right. Well, and it's occurring to me that, you know, there's been a shortage of care providers in
That's
this
right.
field for a while, and they talk about the liability, but if we're getting bad outcomes, that would seem to create sort of a vicious cycle, because we're not doing the groundwork that we need to have better outcomes and make it a more attractive field for people to go into.
And this is something where the demand is there.
Oh, yeah.
And so the market, you know, there's a lot of people who say that, you know, the market will just, people will be attracted and they'll come and whatever. Like, no, this is where we need to have interventions. We need to be cultivating this workforce. We need to create a favorable regulatory environment. And by that, I mean, Medicare and Medicaid should be reimbursing for doula care, right? Like that kind of thing is incredibly important. That's what helps facilitate access, right? If we know that these providers will be able to be reimbursed, it's not up to just wealthy birthing people who can pay out of pocket for these advocates that have, again, clinically, like, I don't want to use clinically proven because that has a connotation, but it's like very clinically demonstrated positive impact on the outcomes of that interaction, right? Like people live. We want them to be all over. It's important. It's important.
Sure. Sure. Well, there are parts of the bills that look at data, and that's an important part of this package as well. Can you talk a little bit?
Yes. Okay. So we know, for example, that in many places in our country, right, the vital statistics, death rates, are collected maybe by a coroner or somebody. You might have like a registrar or something like that in your county or community that's in charge. We found over time that maternal death rates have only been counted if it's explicitly listed on that birth certificate that there was a pregnancy related complication. What that has meant is that if somebody dies of a suicide or an overdose, suicide does not say maternal suicide, it just says suicide. So there's an undercounting. If we can solve this problem by helping and funding more analysis, more robust data collection, reporting, and analysis, then we can have a true encapsulation of this problem in every community, right? So this disparity exists with an undercounting of maternal deaths. So what's that true number? Then we can really embrace those solutions to solve the problem once we have the accurate reporting and data collection everywhere. Because some places are, you know, doing great, and some places are really lagging behind and struggling with this.
Sure, and we've talked to some groups locally, and they've told us about the things they're trying to do to work on these issues. Foundation for Delaware County, different groups that really try to support maternal health. But as you said, it's spotty and you get different data from different places, and that's hard to tackle the whole issue.
That's right.
Um,
And then there's also, one of the things that we call ourselves the Black Maternal Health Caucus. It's called the Black Maternal Health Momnibus Act, but this is really about solving this problem with a multicultural lens. And one of the other groups that has a significant disparity in this country are Indigenous people, Native American birthing people. And there is, within our Data to Save Moms Act, which is the one you're talking about, there's a commission for a comprehensive study on maternal mortality and severe morbidity for Native American pregnant people. And I think that that's really important just to note, because we know that there are unique challenges within our tribal healthcare systems and for this community as well. And so I don't want folks to walk away from this talk and think it's only about the Black experience. This is something that helps everybody. There's something in here for everybody. And when we improve the quality of care for those who have been most impacted, most harmed, it improves it for everybody across all of our communities.
Exactly, exactly. You mentioned that there was something in the most recent COVID rescue bill. Can you talk
Yes.
about that?
Okay, so the American Rescue Plan is the most recent COVID stimulus bill. And a lot of talk has been had about the checks and the vaccines and the money for schools and putting people to work. Well, tucked in there was, for the first time, a postpartum expansion for Medicaid. So for states that didn't expand Medicaid under the ACA, the coverage cuts off 60 days
Mm,
postpartum for people after they deliver. Now, this is why it's important. So for Medicaid nationwide, the program pays for 2/3 of all deliveries for Black birthing people in this country. So significant. In Pennsylvania, the statistic is similar. I think it's like 60% of all deliveries in Pennsylvania are paid for by the Medicaid program. If we can ensure that those moms don't lose their coverage 2 months after having their babies, we have the opportunity to save so many lives, right? Because imagine if you couldn't afford your healthcare to begin with, right? Like it's too expensive. And all of a sudden, maybe 3 months, 6 months after you deliver your baby, something's wrong. Are you
mhm.
gonna really make that tough choice with your limited dollars?
Right,
If the baby needs something or you need something, right?
right,
So often that mom is gonna choose to save her money and help that baby, and then she doesn't get the care that she needs.
right, right. Yeah, that was huge, and that did bring us more in line with what other developed countries are doing. With respect to having postpartum care that extends to a more reasonable length.
The year-long postpartum period is so important. This is legislation that had been led by Robin Kelly. It actually had passed the House unanimously in the last Congress, in our freshman Congress. And I think it's important for folks to remember the politics around Medicaid have changed. Even in the context of the Affordable Care Act, people recognize the need for people to have healthcare coverage, especially in a pandemic. And I'm
Mhm.
so proud that we were able to get this accomplished
Oh, it's
together
great,
last month. Yeah.
great victory. Well, I know we have people who are watching who'd like to know what can they do to get, to participate in advocacy to support the Momnibus to
Okay.
get it
Well, Mary
across the
Gay, I'm
line in
so
both the
glad you
House
asked.
and Senate.
Yes. So there's a few things. One, you can follow us on Twitter at BMH Caucus. That way you can keep up with all of our work. The second important thing to remember is you all are so lucky. You have a great Congresswoman and Mary Gay Scanlon, who has been a champion for all things maternal health. However, you also have two senators, and we need those two senators to be on board with the Momnibus too. And so we know that Congresswoman Scanlon is supportive of the bill. So we want you to focus your advocacy and make sure that your senators understand the problem and the opportunity to solve this problem by supporting the Momnibus. And so I would invite you to reach out to those individuals, and it could be a simple conversation. Please support the Momnibus. That's it. Real straightforward. And then they and their staff will know what to do.
That's perfect. Well, we've had the questions, we had some submitted in advance, and we had
Yeah.
some that I had staff members wanted the answers to. Is there anything that we're leaving out here that we should talk about?
So, we're having a lot of success with the Momnibus. This month, we're expecting our first legislative hearing on the Protecting Moms Who Served Act, our Veterans Bill. and that's bipartisan. And I'm excited to hopefully continue to get this legislation moving forward. We're up to 3 bipartisan bills in the Momnibus now. And I'm hopeful that we'll get these enacted into law. Let's get them signed, you know? And together, I know we can do it. So thank you for shining a big, bright spotlight on what's happening in Pennsylvania. Thank you for being such an incredible partner as we do this work to save moms' lives. And I am looking forward to being able to show up in Pennsylvania in person and see the impact of our work once we can get this legislation across the finish line. Be an honor to join.
That sounds great. And thank you so much for your leadership in this arena. It really is inspiring. It's so necessary, but you make it easy to, come along
Yeah,
and support these bills. I mean, it just makes sense for our
thank you.
entire community. So,
Thank you.
Lauren Underwood, representative from Illinois, thank you so much for joining us tonight. We really, really appreciate it.
Thank you. Good to be with you.
Okay.
Take good care of yourselves, everybody.
Okay. Bye.